on this day-to-day basis as we implement both new efforts and directives, both to slow the growth of positive testing of COVID-19 and to take care of our fellow Montanans during these times. I have several updates I want to share with you today. In addition to monitoring the impacts of coronavirus on our state from a public health perspective, we're also doing so from an economic health perspective, and we're looking at every avenue available to take care of employers and workers. So I want to talk about a few things that we've just gotten into place in the last 24 hours, and then also provide a little bit more information on some of the public health related issues. The first I wanted to mention was unemployment insurance, and with me is the acting commissioner, or the commissioner of the Department of Labor and Industry, Brendan Nordland. One of the best ways to really slow the spread of this disease is certainly to make sure that folks who are sick and can stay home from work without worrying about how they'll continue to make ends meet during those times of illness. And pleased to announce that we just received approval today from the United States Department of Labor to allow workers who are quarantined with COVID-19 or who are temporarily laid off due to COVID-19 related either business closures or reductions in service, that they can immediately access unemployment insurance benefits. Those rules were just filed today with the Secretary of State. So those who are staying home from work to care for a family member who's quarantined due to COVID-19 will also be eligible for UI benefits. Additionally, the emergency rules waive the typical 1-week waiting period to access unemployment benefits to limit the gap that Montanans have between paychecks during this challenging time. And if the employee takes reasonable measures to maintain contact with their employer and intends to return to that place of work, the requirement to apply for jobs every week will be waived. Montana employers will also receive help through these rules. Individual claims won't be chargeable to a specific employer's account. Finally, the rules include a provision that could extend the time employers have to file wage reports and pay unemployment insurance contributions if that delay is related to COVID-19. These emergency rules go into effect immediately. Workers can file a claim immediately for UI benefits online at montanaworks.gov. I'd also encourage workers who are displaced due to either job reductions relating to COVID-19 or if they were staying home to take care, to do it online. Go to montanaworks.gov because that'll make it that much more efficient and effective both for the worker and for the agency. So that's one of the issues I want to raise. Another is relating to emergency loans for small businesses. Emergency loans are now available for small businesses in Montana impacted by COVID-19. Small businesses will be eligible to apply for those emergency loans through the Small Business Administration. Earlier this week, today's Tuesday, yesterday, I submitted Montana's request for this assistance through SBA's Economic Injury Disaster Loan program. We pushed for quick action. We got results. Received word today that businesses in every county of our state are eligible to apply to up to $2 million in 30-year loans with an interest rate of 3.75%. Ensuring that small businesses in Montana have access to capital and resources that allow them to weather temporary closures and bounce back from some of these critical quarantine efforts is certainly paramount, I think, to all of us. Third, driver's licenses. In consultation with Attorney General Fox, have determined that certain motor vehicle division offices are unable to open due to restrictions on entry by commercial landlords. And when we were consulting with the Attorney General, learned of this because the landlords have restricted access. And no one in this time of sort of challenging should have to worry about waiting in the line to renew an expired driver's license. So for this reason, I'm also extending by 90 days the time to renew driver's licenses that would have otherwise expired in March, April, or May. Wanted to provide at a higher level an additional note with school closures. Certainly, I think that, and I've heard from districts all around the state, they're ramping up, trying to make sure that services are provided even in this time of school closure. And wanted to make clear, my intention was to give schools this 2 weeks to plan for how we provide services for our students, and recognize that most of them are already in the process of implementing the provision of those services right now, and committed to making sure that teachers and staff and everyone gets paid as we best determine how to serve students in these challenging times. So any concerns that the money from the state will dry up tomorrow as they're planning, even if they're not having remote learning or others, there's nothing to worry about during this 2-week period. And I also commend those schools that are already exploring options to provide quality instruction and the other services to their students during this period of closure, and we'll continue to work with our partners at the Office of Public Instruction and in districts all across the state as we as the situation evolves and we act and react to it. Couple issues on healthcare related issues. For one, that we've been able to expand the options for those on Medicaid when it comes to testing. We know that our health insurers, by and large in Montana, have waived copays when it comes to testing, but we still do have some population in the state of Montana, probably 6%, that have no health insurance either through Medicaid, Medicare, or private employers. We want to make sure that anyone that is symptomatic has the opportunity to test, especially, and if those without insurance aren't getting tests because of the fear of those costs, we wanted to address it. So uninsured Montanans who still receive a recommendation from a provider will now be eligible to receive coverage for COVID-19 testing and if they test positive treatment. And I think this is a significant step in containing the spread of coronavirus in our state. We know that the lack of health insurance often results in the delay of seeing a doctor or being turned away, which could further fuel the pandemic and put other Montanans at risk. If confirmed positive for COVID-19, state funds, with the potential for federal, still not sure, but it will be used to cover treatment costs. And as is though required for all COVID-19 testing, eligible Montanans will be required to provide that recommendation from a provider according to current CDC guidance, and should first call to confirm that the provider believes that testing is warranted, and then make those arrangements to be tested safely. Medicaid, Medicare, and CHIP recipients are currently eligible for coverage for COVID-19 testing and treatment. Additionally, Montana's private health insurers did announce that they're voluntarily waiving copayments and deductibles related to those testing as well for their customers. It's going to take all of us at the end of the day working together to slow the spread. That includes looking out for those who don't have health insurance, particularly those that are most vulnerable. I know that I'll be asked at some point, so there's currently 204 tests going through from the state lab today. We don't have results for those tests, but also wanted to update from presumptive positive tests that we've received. We know that there are a number of positive tests that have been connected to the Board of Regents meeting, meaning individuals that were at that meeting that tested presumptive positive. I'm aware of another one of those that are presumptive positive tested that did come, at least did attend the Board of Regents meeting. So local public health authorities have reached out to all of those individuals that had registered to attend the Board of Regents meeting and doing a number of things, one of which is certainly, once again, reflecting that they should be quarantined until March 21st. And then if anyone is symptomatic in any respect, they are being tested as well. For those that might get this information from the media, if you haven't not been reached out to by a local public health official, because look, people attended this meeting from all across the state, and they've been working diligently to contact all of those individuals. But if you have not been contacted by public health officials, I would encourage you to reach out to your local public health folks, both about the quarantine and if any testing might be necessary. So, look, in closing, as we both work to lessen the impact of COVID-19 in Montana, prevention is certainly the treatment. We're taking all of these approaches, continuing approaches, to ensure that our state's better off in the long run, and we'll also do what we can to communicate frequently with Montanans, especially as new decisions are being made each day to protect the health, safety, and economic livelihoods of our communities. So, again, your coverage and all of your efforts is a pipeline to provide this information to the folks of our state. And as I thank you, I know that our citizens thank you as well. So with that, are there any questions?
Hey, Governor Bullock, this is Williams.
One more time, I'm sorry, I didn't hear the start, so just begin from the beginning.
Sorry, Governor Bullock, this is Riley with Mr. Williams. I have two questions. For one, they need a provider referral. Is that referral also free? And number two, how will the coverage for uninsured Montanans, how will that be paid for?
So the number one, yes, the provider referral would be paid for by the state of Montana as well. And as far as how that funding is, and we'll see if the feds ever act on it, but this is the authorities that I have in using Medicaid dollars.
Okay, thank you.
Absolutely.
Governor, this is Justin Prince at the Flathead Beacon. I know a number of counties have closed bars and restaurants. Are you considering a statewide closure at this time?
You know, Justin, have been in some discussions, you know, and I do commend those local county health authorities that have made that determination and have not made a determination to a statewide closure at this point, but that doesn't mean that that won't happen.
Thank you.
This is Catherine Houghton with the Chronicle. I know that there are still some folks who don't meet a threshold for testing. Is anybody in the state, either state health department or local health department, keeping track of the people who did not qualify to get a test?
So, Catherine, you mean like if you walked in tomorrow and said, will you test me? As been an example.
I think like if somebody called last week and they had symptoms, but they didn't meet last week's thresholds. Does somebody have kind of a tally of those folks who had symptoms but didn't have a threshold, like traveling out of state? If anybody's keeping a tally of those folks.
It's decisions made by them. You know, the decisions being, the decision whether or not an individual is tested is made by the individual medical provider, so we would not have those tallies.
I did hear that providers do make the initial call of whether or not to take a sample from patients, but I heard that the state lab does have the final say. Is that not accurate?
No. So just so we're clear how this works is like in any community the test actually occurs either at the state lab or it occurs through some private labs, which some healthcare providers have existing relations. But if a sample is sent, so it's essentially it's a swab. If the swab is sent to the state lab, that means a test has occurred by recommendation of a medical provider, and the lab runs all those tests. Any other questions?
This is Nikki Willett. Nikki Willett with Yellowstone Public Radio. Earlier today, one of the hospitals in Billings said that the private lab it was sending its test to, I'm not sure if it was for flu or for COVID, but that lab was so overwhelmed that it was now a 9-day turnaround period. I know the state lab has been turning results out within 24 hours. Do you foresee that timeline still being like a 24-hour, same-day result? Is that still going to happen, considering that there's going to be more tests coming into the state later this week?
Yeah, and thanks for the question, Nikki. I mean, I had recently even walked out of a meeting having discussions about overall testing capacity. That no, there will be at some point the potential that, you know, as you noted, that private labs said this long, that we've been able to date, do a 24-hour turnaround, but that may change, and we're always going to be working on trying to increase the opportunities for testing capacity.
Bullock, states employees have reached out to us.
I'm really sorry, Governor. I didn't hear anything you just said. Can you please repeat, and can everyone please mute?
Okay, yeah. If anybody else is there, if you could please mute your phone. Whoever's talking, please mute your phone. Thank you. Ask the question again, Nikki.
I didn't hear anything that you said in response to my first.
No. So the question is, do you want to ask the question again?
Do you expect the state lab will be able to maintain its same-day turnaround, considering there are more tests coming into the state later this week?
So as of today, as an example, I think that the state lab is testing about a little over 200 individuals. That there will become a time where there are capacity constraints. Had recently even walked out of a meeting where we can explore what other avenues there might be. But yeah, the 24-hour testing that we've been able to do to date is probably some of the fastest that I've heard in the nation. As additional tests come in, though, that we'll monitor, and we'll also be fairly transparent with you as far as how long testing is taking from the time that we get it.
This is Mary with NBC Montana. I have a question about tests as well. How many tests do we have available?
And could we, if you're not asking a question, or once you're done asking a question, could you please mute? Would you please mute your phone? All right. So hopefully you can hear me, because some people are muting their phone. The question was how many tests we have?
Yes, my question was how many tests do we have available? I had heard something about getting
Yes, we just got additional, probably 1,000 tests from CDC today.
Yeah, I think so.
I'm sorry, can you repeat that? I think someone else is.
Yeah.
What's that? 1,000 additional tests that we received today. So it's approximately 1,500 tests right now we have in state, on the state side. Please.
Governor, certain state employees with pre-existing conditions like diabetes are concerned that they haven't been sent home yet to work from home. Do you want to respond to that?
So two different things, one of which, when we put out guidance to all state employees, which went out yesterday morning, that said that if you have certain health conditions, talk to your manager and talk to the folks in the agency about the possibilities of telework. And then as this is rapidly dynamic from a greater perspective, we're looking at, potential telework options for certain state employees as well. But to the extent that any individual feels that they have health compromises that could be challenging, that they received guidance yesterday morning as far as how to go through their individual agency.
Is there any word on when tribal hospitals will start testing?
Was that a question or was that chatter? Oh.
Governor, this is Corin with Montana Public Radio. Is there any word on when tribal hospitals will start testing?
So, Corin, my understanding is that tribal hospitals and Indian Health Services, they are testing right now.
And will the state lab run those?
So there's both, with IHS has a contract with certain providers. It can either go to those labs or it can go to the state. Any other questions?
Governor, Mike Hammer here in KOFI, Kalispell. Yesterday you gave some updated numbers as far as those that have been tested. I think you said 109 were tested just yesterday. Do you have any updated numbers on those?
Do with that? Yes, I do. How many have been tested and what's that? 311 have been tested to date. 204 tests are being run today. And all this information is COVID-19. What's that? Yeah, and I'd also encourage you, because we're trying to update it as real time as possible, at covid19.mt.gov. We're putting both the number of tests that have been conducted in the past.
All right, thanks, Governor.
We have time for one more question.
Any more questions? Well, again, thank you very much. We'll try to keep you updated as we go forward.